We welcome Dr. Daniel Kellman, who will facilitate this presentation.
All right, good afternoon. Thanks for welcoming me back to Barbados. This is my third time here, and thank you so much to Jan, Linton, and David for all the hard work that they put into these conferences. It's really something to behold. So much talent here, and it's certainly many tough acts to follow. Also, shout out to the sound crew and all the technical work that went into this. Also, if Pastor Paul is listening virtually, miss you, man, on this trip. But what an incredible gift and resource to this island with his spiritual counseling and his years of dedication to cancer support services. So I just wanted to mention Pastor Paul. So I'm Dr. Daniel Kellman. I'm a naturopathic physician by trade. So to answer just briefly the question about studying herbals in medical school, there are medical schools in North America that are called naturopathic medicine degrees, and we do learn how to diagnose, treat illness, prescribe medication, but we do focus also on herbal medicines, homeopathic prescribing, vitamins, minerals, supplements, all kinds of natural interventions, including intravenous and minor surgical techniques as well. So I just wanted to mention that. All right. So I do have a degree in naturopathic medicine. I'm also studied in functional medicine, which is also an available training for MDs and DOs, which is kind of another way of labeling natural therapies and looking deeper into how inflammation might affect disease and chronic disease, the microbiome, our gut health, food allergies, and genomics. So those are some of the areas of functional medicine. Currently, I'm with City of Hope, so it's actually Cancer Treatment Centers of America, which I've been here representing them in the past. They were acquired by City of Hope, which is a hospital system out of California. And so they did purchase Chicago, Atlanta, and Phoenix to expand their national footprint. And we are now a non-for-profit hospital system. And I'll explain a little bit about that. Currently, I'm seeing patients, and I'm also managing several teams that we would describe as supportive care and integrative oncology. And so that would include naturopathic medicine, nutrition, behavioral health, pastoral care, and oncology rehab. So City of Hope started in 1913 and was established to help deal with tuberculosis. They would actually send people out from Los Angeles as far away as the train would go out into the desert, into some tents. It started off as this place where very sick patients could go to. In the beginning, most of them didn't survive, but after a while, they started figuring things out, and they became known as the City of Hope. And so that's where it started. So now it's a national cancer system. They've done a lot of work actually with diabetes through the years, and we're involved in the original research that led to synthetic insulin. And even now, more modern monoclonal antibodies have been researched there, so the development of certain drugs in their research, like Herceptin and Avastin, some of the really groundbreaking oncology targeted treatments. So City of Hope also has done more bone marrow transplants than any other hospital system in the United States, and now it's actually at 20,000 since this slide has been on this presentation. So we do have now a national footprint: California, Arizona, Chicago, Atlanta, Phoenix. They also acquired TGen. So this is translational genomic research and are looking for, what are the vulnerabilities of cancer when you map out the human genome, and then you can map out the cancer genome, and you can figure out, what kinds of therapies could go after a very specific type of cancer. So it's a really amazing kind of collaboration. So I'm going to talk about integrative care, supportive care, and in particular, the science behind hope. And so usually I talk more about specifics and side effect prevention and herbal medicine. So this is kind of an interesting convergence of different practitioners. We have a very conventional Dr. Nimrod, who ends up talking about herbal medicine, and I'm going to talk a little bit about modern medicine today too. So it's a really nice blend in that there's so much integration and so much discussion, because I don't think anyone has all the answers, but I think when we work together, we can get closer to that. And I think from what I've heard in Barbados, and I think it's true in a lot of different places, there sometimes feels like a dichotomy in philosophies, and it shouldn't be either or. It shouldn't just be either alternative medicine or conventional medicine. We need to figure out how to use all of these things together, okay? So an integrative approach to treating cancer involves using the best of modern conventional medicine, chemotherapy, surgery, radiation, targeted therapies, and then combining that with the therapies that can get you through the treatment with supportive care. Because we don't want to forget about energy, stamina, strength, digestive function, nerve function, quality of life. So we need to attack the disease itself with aggressive therapies. We need to just knock it down, right? But then not forget about the person. That's where the supportive care can come in. When you deliver those kinds of therapies simultaneously, that's when we have integrative care. Supportive care really takes a whole person approach, and it's about minimizing suffering, maximizing quality of life. Minimize suffering, maximize quality of life. So the supportive care not only treats the patient, but also the family, other caregivers, and addresses many of the complicating factors, not only side effects of treatment, but also the disease itself. And we try to remove some of the barriers to treatment, practical, social, emotional, psychological, spiritual, physical. Cancer doesn't just affect the body. It affects so many of the other aspects of our life, and we need to address those. Supportive care can also improve and almost democratize cancer care by improving health equity, because if we can remove some of those barriers, then everybody can get the cutting edge treatment, right? So that's a big part of, say, what our social workers do. They will try to identify social determinants of health and then remove some of those obstacles. We have financial counselors who can look for grants or make sure that their insurance coverage is sound. All of those pieces are so important. We just want to take all those stresses away. This Dr. Jerome Groopman wrote an interesting book called The Anatomy of Hope, and also a hematologist and oncologist by trade and a writer for the New York Times. This particular paragraph really struck me as a good definition of what hope is, especially in the context of cancer. Hope is the elevating feeling we experience when we see in the mind's eye a path to a better future, when we can visualize that. Hope acknowledges the significant obstacles and deep pitfalls along that path. So it's grounded in reality. True hope has no room for delusion. Clear-eyed hope gives us the courage to confront our circumstances and the capacity to surmount them. I just feel like that really encapsulates, what hope is, and it's being truthful, it's being authentic, and it's also giving people a pathway, a vision of how to get from point A to point B. When that's there, we can set goals. We can have the agency and the energy to achieve that and find pathways to getting there. And that's actually how hope measurement and hope scales have been created are on those three factors: setting goals, having agency or energy, and having pathways, ways to reach those goals, okay? So there was an article in The Lancet in 2020 regarding the science of hope. So I pulled a lot of this next several slides from this article because it just had a lot of great links to really good evidence-based descriptions of hope and how hope can be very, very helpful in patients coping and also potentially with outcomes in treatment. So hope is associated with healthy behaviors, and that would include being a non-smoker, exercise, and having dietary changes. So there is a connection to that. And this can have relevance to cancer, as mentioned here. There was a study with colorectal cancer that was advanced. Those who exercised, vigorous exercise, actually had better progression-free survival. There's many studies with exercise and lots of different cancer types that show improvement, not just progression-free survival, but overall survival in some of the cancer types, especially with prostate cancer. Having hope also helps one to educate themselves, to strive for strategies to overcome the disease. And so that's also another aspect of what hope can do for someone. Having a higher level of hope also helps with expressive coping and being able to express emotions healthfully. And then also being able to sustain hope after treatment. So I thought that was very interesting. Less distress, equals less medical visits. So that's another downline effect of having hope. So it is hard to find a direct correlation. I mean, we can't just say, okay, this person's hopeful, we're going to see their disease shrink. Well, we don't have that, right? But we do have the opposite side of the coin, which is that when someone is distressed and when they have anxiety and worry and despair, we do know that that can actually lead to physiological changes that increase the disease and the progression of disease. So by common sense, hope is important to kind of turn that to the other side, right? It's also very interesting that the value of hope does not really go away when someone gets bad news, if they have a maintenance of hope. So they actually studied this and found that there was no change in hopefulness if they were received bad news or good news. If they had, that part was being addressed by their physician and their care team. So as long as the information is being conveyed in an authentic and truthful manner. So as I was just mentioning, depression and stress can increase the incidence of cancer and worsen prognosis in malignant disease. So hope and optimism are very important. And really the link is that stress leads to inflammation, inflammatory mediators, inflammatory cytokines, drive some of the pathways that lead to cancer development or progression of cancer. So pro-inflammatory cytokines lead to certain kinds of behaviors, such as depression, somnolence, sleepiness, anorexia or not eating, anergias or fatigue, and the perception of pain and having poor pain tolerance. So, you know, when we can flip it around and be more hopeful, this can actually be a mediating factor to all those stressors that can lead to inflammation and perhaps, you know, progression of disease. So I would contend that hope can be a therapeutic target, right? Thus the importance of having supportive care and integrative oncology. So when someone is feeling better, physically, they feel better mentally and emotionally. When they feel better spiritually, they're able to have that get up and go to fight. So reducing symptoms with supportive care can help someone feel more hopeful. And in our hospital, we use physical modalities, mobility, exercise, physiology, naturopathic interventions to help with energy. There's a study with American ginseng. I know Dr. Marissa mentioned that. And of course, nutritional approaches. And then also not forgetting about the social, spiritual, mental, emotional interventions. That's our social workers, psycho-oncology, therapy, mind and body medicine, and also the spiritual care. So I feel very lucky to work in a hospital where we have all of those modalities under one roof and get to interact with patients in that way. So physicians can play a role in hope. And that's by showing the patients that you care, by listening very closely, maybe validating what they're saying, engaging with them in the discussion, perhaps summarizing what they've said and saying, what I hear you say is. These are techniques that can be very helpful because that gives someone hope when they say, okay, I think I found a partner, someone who's going to listen, right? Also, being confident and competent. How many surgeries has this person done? And are they explaining things to me that I can understand? As a layperson, that also brings confidence and hope. Providing options that can show improvement, how to get out of their situation, also really important because then a patient can start to visualize how they can get, again, from point A to point B. And it could just be a small win. It could be stage 4 disease, and you still want to be hopeful. You still want to say, okay, well, here's our first small goal that we can get to. Those wins just mean so much to someone, right? And that goal setting is part of, again, hope. So what I believe is that when we combine science, right, evidence-based medicine and modern medicine, which continues to get better and better, with hope, that we actually get a whole that's greater than the sum of those individual parts. And that's where I think the magic can really happen. These are the patients, and Elaine could probably attest to this, that they were told by maybe another provider that they had 6 months to live. They come to us. Here we are, and I've been 18 years with this organization. I see patients 8, 10 years after they were told these things, because there's always new medicines coming out. If they're nutritionally sound and they're staying positive, it can just have a really, really large impact on outcomes. So, well, why is conventional oncology important? Because spontaneous healing, while there are documented cases of that, they're not predictable and they're very rare. There is a book, if you're interested, Kelly Turner wrote Spontaneous Remission, Radical Remission, and also a book called Radical Hope, Kelly Turner, Radical Hope and Radical Remission. Reading those things can be inspirational, and it can also tell aspects of what maybe those individuals were doing to and show some common link between all the different patients who maybe had a spontaneous healing, spontaneous remission. If curable intent treatments are an option, don't miss that chance. Early detection and screening is key. That's been a theme for today, right? Make sure that you don't miss that opportunity. Find your treatment team, find your experts, and please listen to them. Follow that pathway, but also find your support team. It takes courage, but you can do it. I know that you can, and there's so many resources here, with Jan's group. Conventional treatment should also be seen as miraculous and God-given, not just some science jumble, right? Because think about all of the hard work, inspiration, discoveries, and blood, sweat, and tears of a medical student, and then years of practice, and just how much value there is in that. So, I've seen patients that came in as new patients, and they said, I'm not going to do the chemo. God's going to heal me. Well, who provided the knowledge to all those physicians to be able to help heal, right? Let's not forget about that point. So, a surgeon once told me when I was working at our hospital system in Tulsa, Oklahoma, that the first shot is the best shot. So if there's an opportunity for surgery to remove all the cancer, let's do that. Let's take that opportunity. Sometimes chemotherapy isn't needed. And again, that comes down to early detection, and being able to have that opportunity for that first shot being the best shot. We also have the Da Vinci machine and robotic laparoscopic surgeries now, which mean better healing, quicker healing time, less damage, less tissue damage. And so there are cases where with prostatectomies, that can be done laparoscopically, total abdominal hysterectomies, laparoscopically. So that's something to also consider. I mean, if it can be removed with a lot less damage, then these are options for patients. We've also in our center done a form of ERAS, which is Enhanced Recovery After Surgery, and we called it the ASSURE program, Advanced Surgical Recovery, using a lot of different modalities, including immunonutrition, which was mentioned this morning, basically a nutrition drink similar to Juven. The one we used was called Impact Advanced Recovery. And then after surgery, we use naturopathic interventions. We found that there were less hospitalization, time of hospitalization need, and also better wound healing, and a lot of different improvements, like less opiates being needed in their care. So to kind of piggyback after Dr. Marissa on chemotherapy in plants, there are actually a lot of chemotherapy drugs that are derived from natural sources. So, Taxol is the classic kind of breast cancer treatment. It's also used in lung cancer. It comes from an evergreen, the Pacific yew. Let's think of some of these things as plant medicine. Every medicine can be a poison, and every poison can be a medicine. It all depends on the dosage, right? So the vinca, it's a beautiful flower. Vinca alkaloids coming from the Madagascar periwinkle plant are used in treating lymphomas and leukemias. Irinotecan, Dr. Marissa mentioned that in terms of a drug interaction. But this comes from from a tree, and etoposide from the mayapple plant, another chemotherapy drug. So there's things taken from the sea cucumbers and such. Eribulin, I believe, is the drug. So I like to think of these things that way as plant medicine. Conventional treatments, continuing on, as Dr. Kaish mentioned today, radiation therapy is much more targeted, much more advanced. Even in stage 4 disease, there's something called oligometastatic disease, which means fewer than 5 sites in the body. Radiation can be used to improve outcomes in certain cancer types. This is ongoing research. More research is being done on this and being combined with other therapies. Injectable forms of radiation, such as Pluvicto, sort of seeks out and destroys cancer cells that are seen on a PSMA PET scan. This is something that also is showing a lot of promise and is a new concept in the way that we deliver radiation. Liver-directed therapies, including things like radioactive beads being injected to where you embolize a vessel in the liver and the radiation collects right on the tumor. Thank you. And then as Dr. Kaish was talking today about brachytherapy, the seed placements or putting catheters and delivering radiation. So my point is that there's just so many advancements, so many major advancements that have been made to become more targeted, more individualized, and it is quite astonishing. There's also a greater understanding of tumors having a very unique signature, and we can look at that with genomic testing called next generation sequencing. You're able to actually find out, are there specific mutations that are being expressed that you can then go after with a very specific targeted drug and maybe avoid chemotherapy. Personalized therapies are being crafted for this to go after those mutations and specific biomarkers. Also, immunotherapy is showing great promise. And then the list of disease types just grows with every year in terms of how we can use immunotherapy. So there are the targeted therapies would include MABs, MAB, so monoclonal antibodies. So if you see any drug that has the ending like trastuzumab, cetuximab, they attach to the cell surface, the cancer cell surface, right? And they block a receptor which inhibits a pathway that's driving the cancer. They also now have them where they combine the monoclonal antibody with a chemotherapy. So it essentially attaches to the cancer cell surface and then injects chemotherapy inside the cell. Okay, so new drugs with breast cancer like Trodelvy, for example, are being used in this way. Then there's small molecules that also work inside a cell, and those are the drugs that end in IB. So these are things like tyrosine kinase inhibitors. So you might see oral medications like olaparib, for example, imatinib, and that's what those are. So I'm just giving you a little bit of nomenclature and what to understand what those things are and how they act in the body. Sometimes having an understanding of mechanisms is a good thing to focus on instead of side effects, because then you can start to visualize, which I think is very important, visualize how these things work inside the body. So it's good to have that in your mind's eye. Checkpoint inhibitors, immunotherapy, this has just been such a big revolution. I mean, there's stage 4 melanomas and advanced lung cancers that are being treated with immunotherapy and having much longer durable responses with treatment. Some of them, cancer cells and cancer will try to shut off our T cells, and they'll put little locks on our immune system. And these drugs actually go in there and unlock our T cells to kind of unleash the fury of our immune system against the cancer. These are the PD-L1 inhibitors, ipilimumab, nivolumab, for example. Pembrolizumab is a big one that we use now, Keytruda. Also, CAR T therapy is amazing, in some cases curing up to 90% of leukemias. So they basically take out blood, they do apheresis, they take out the T cells, then they supercharge them kind of genomically to then go, they're re-injected back into the body, and then they go directly after the cancer. So this is another form of immunotherapy that is right now being used in hematology, but will be used also in solid tumors, and it's very exciting. So, modern oncology is amazing. So be open to the possibilities. Do read about the mechanisms of action. Try not to focus on the side effects. I mean, if you read the back of an aspirin bottle, you might not ever take it. But those side effects have to be listed because There's laws around that. But if you look at the original studies for most of the drugs, it might only be 3% of the participants had some level of one of those symptoms. So again, there are some that we're going to definitely see with chemotherapy, side effects like neuropathy. We know that those are going to exist, but that's why we're there, to continue to figure out ways of reducing, minimizing that side effect. So instead, focus on the prevention, staying positive, and then engaging in healing practices. These are the things we want to shift away from being, living in fear, and we want to move towards what can we do every day to engage. So as I mentioned, I'm a naturopathic physician by trade. So what we do in the hospital is help with minimizing side effects of the treatments. We look for herb-drug interaction possibilities, so we have patients avoid certain things. We can also time it based on the half-life of the medications that they're taking. So there's certain things that would be appropriate with certain regimens and others that wouldn't be. So that's where we can be really helpful. Some of the common quality of life symptoms that we help with are energy level, neuropathy, which is numbness, tingling on the hands and feet, pain, reducing inflammation, reduces pain in the body, digestive function, keeping the gut lining healthy, reduces inflammation throughout the rest of the body and just improves our health. Optimizing the immune system function, augmenting the anti-cancer approach, and then focusing on prevention and survivorship. So the last part of my talk, I just wanted to at least leave you with some things that we found helpful, that we feel are very safe. There's a remedy called arnica. Some of you may have heard of that. It's good for bruising. Sometimes sports creams will actually have it. We use the pellet form. There is some research with it in reducing seromas after breast cancer surgery. This particular study also used Bellis perennis, which is a homeopathic medicine. But we find that our patients are able to get off opiates quicker. Some patients say, you know what, after a lumpectomy, I just want to try to not use any opiates. I just don't want to use them. And so having some tools like arnica can be great. And we also use some natural anti-inflammatories that can be helpful. Probiotics have been associated with better wound healing. And so, making sure either through supplementation, having a prebiotic and a probiotic combined, that we call them symbiotics, can be very helpful, or also making sure in their diet that they're getting probiotics and restoring gut health, especially if there's been a lot of antibiotic usage, which oftentimes after surgery, there's going to be antibiotics used. Immunonutrition drinks, like were mentioned before, with glutamine and arginine, some of them have omega-3 fatty acids, have been shown to also be helpful, especially doing kind of pre-surgical, and then some of these items post-surgically as well. Other supplements that we use after surgery would include vitamin C, and natural anti-inflammatories, because as was mentioned earlier, the phases of healing, there's an inflammatory phase, and you got to get people past that inflammation to then move into the healing phase. So bromelain, curcumin, boswellia, quercetin, all these kind of natural anti-inflammatories. But be cautious about blood thinning, as Dr. Marissa had mentioned. And leading up to a surgery, we really try to clean the slate and not do these natural anti-inflammatories because of the blood thinning. We don't want a surgeon to have to, try to cauterize and not be able to cauterize very easily, right, if there's bleeding. Prevention of radiation side effects. Aloe vera, it's one of those wonderful healing plants. There's some good study to show that it can help with the skin health throughout radiation. Just make sure that the skin is clear, clean, and dry before each session, but then after each session you can use aloe in addition to other topicals that the radiation oncologist is recommending. We've been really impressed with these probiotic lozenges using a particular strain, Salivarius K through 12. It reduced the incidence, onset, and duration of severe oral mucositis, which I think you saw some pictures of earlier with Dr. Rush's presentation. Very good safety profile, and this is something we've actually been using in the last 6 months and seeing amazing results with patients undergoing head and neck radiation and able to continue swallowing and not have all the problems with mucositis in their mouth and throat. Glutamine is also just a classic one we've used for many years to prevent mucositis. And there's a ton of studies with glutamine. I have patients mix a tablespoon, which is about 10 grams of pure L-glutamine powder, 3 times a day, mixed in water or juice, and it goes a long way to really help prevent mucositis and help keep the healthy tissues of the mouth and throat throughout treatment. Chemotherapy-induced nausea and vomiting. I know ginger's been mentioned. We use ginger tea, ginger candies, ginger aromatherapy, and even ginger snaps. I've heard people say that helps. And peppermint, smelling the vapors of peppermint oil can be helpful in reducing nausea. Acupuncture can be very helpful for nausea. Eating small, frequent meals. So we just try to teach people all the tools they can to prevent nausea, because if they're nauseated, they're not going to eat. And so that's also such an important part. But antiemetic drugs are amazing too, and it's come a long way with our pre-meds in the infusion center, and knowing which ones to give. And I always advise patients, make sure you get through those first few days. Take your Zofran and Compazine if you need those, because eating and staying nutritionally sound those first few days is so important. Once the nausea kicks in, it's sort of this vicious cycle. So we try to use all of these tools. Again, glutamine comes up, for preventing the neuropathy associated with Taxol and Folfox. There's some great data with that. We use it basically the week following the chemotherapy infusion at the same dosage, up to 30 grams a day in divided doses. Shows a tremendous benefit in reducing neuropathy. Also, cryotherapy is really popular now, where during the infusion, putting ice on the hands and the feet can constrict the blood vessels and prevent the chemo from going to the periphery and damaging the nerves. A lot of things that we are looking at in terms of preclinical data and some clinical data with B6 and B12, B-complex, lion's mane mushroom extract, and being supportive on the nerves, vitamin E, acupuncture, and also infrared light treatments called the cold laser. Fatigue is probably the #1 complaint I hear from patients across the board. Using exercise and psychological interventions is one of the best things we can do for cancer-related fatigue, and thus all of the different departments that we have to help with that, which Elaine's going to be going into. We also, ASCO had a study in the Journal of Clinical Oncology. It's probably been about 10, 12 years ago, about American ginseng, Wisconsin ginseng, and helping mitigate cancer-related fatigue. Something I have found in clinical practice to be very helpful. Vitamin B12 is just such a simple thing, and especially under the tongue, sublingual, you get better absorption. And then L-carnitine, not acetyl L-carnitine, but regular L-carnitine for maintaining muscle mass, lean muscle mass, and stamina. That's one of the common things that I recommend for patients who are undergoing chemotherapy, or Lupron Eligard injections for blocking testosterone. The chemobrain cognitive impairment that's associated with chemotherapy, having these healthy practices has been shown in studies to really help reduce the chemobrain incidence. Meditation, mindfulness, movement, exercise, keeping the circulation going. Acupuncture has also been shown to help with that. And these are the references related to the science of hope, which were many. So I'm just listing those there. And I know this was a lot of information. I probably went well over my time. But I wanted to thank, again, Cancer Support Services for bringing me back. As long as I'm invited, I'll come back. I love this place. It's beautiful. And this is on the more of the east coast of Barbados. So thank you.
I'm Dr. Sean Russell. I practice integrative medicine. Dr. Kellman, thank you for a wide-ranging and very informative talk. I just wanted to share my perspective, whereby one, the thought of combining conventional and alternative medicine, and I think Your talk really shows how much of a better outcome one can have when you bring everything possible to bear to help the patient. And it shouldn't be a competition of whose therapy is better. It should be a matter of what can we use from every part to help the patient. So I thought it was very good for you to show us that.
Thank you.
It's also very reassuring to see the direction of oncology where they're harnessing the immune system, the natural defense mechanism in the fight against cancer. I think that's really the way to go. And to touch on the element of hope and to put it in perspective where everybody knows about the placebo effect, to the extent sometimes up to 20% of positive outcomes are because of the placebo effect. And so what you're saying is use that, because traditional medicine dismisses it, and really we should be harnessing it and using it in conjunction with the other things as you've put. So again, thank you.
Oh, thank you very much.